name is Margaret Wang. Welcome to Mental Health and Margaret. Today we have with us Dr. Jorge Wong from AKI, Asian Americans for Community Involvement, one of the largest and oldest mental health organizations serving the Asian American community in the South Bay area. So, Dr. Wong, tell us a little bit about the services and resources that are unique to AKI.
I'd be happy to, Margaret. And again, thank you for having me come in and speak at your show. AKI, or Asian Americans for Community Involvement, has been around for 40 years. We're actually celebrating our 40th year today, this particular year. We have multiple services. We're a multi-service agency with a large mental health department, of which also has a Center for Survivors of Torture. We have a large medical clinic that has recently become a federally qualified healthcare center, so we'll be able to serve more individuals within the county. We have a large substance abuse department to treat adolescents. We have problem gambling services for those individuals who are having problem gambling and also affected individuals like family members. We have a domestic violence shelter and services and some advocacy services there. Youth prevention and education programs. We also have a senior wellness and prevention program. And also one of the things that we've done since our inception is advocacy. We have advocacy and youth leadership programs. So those are kind of like our 10 largest service lines. And within that, we have multiple different programs. Within the mental health or behavioral health services, we also have, for the last, say, 10 years, we've been developing a very robust training program for graduate students at the master's and doctoral level who are interested in providing, say, substance abuse treatment or mental health services, even problem gambling or integrated behavioral health services or primary care for Asian populations or any culturally competent type services. And we've been developing that program for quite a while now. So in a nutshell, those are the programs that we have. And we've been around, again, for 40 years, serving the Santa Clara County and all the other counties surrounding it.
That's great. So tell us about some of the cultural issues affecting the Asian American community today.
Of course, since one of our main focus is mental health, Asian Americans or Asians as a whole don't see mental health as a part of healthcare issues. From the countries of origin, so oftentimes they may not necessarily have mental health services, or if they do, they're very severe. Asians always think of individuals with mental illness as individuals who are in the chronic and acute phase, or the time when they really need to be hospitalized or placed under some sort of supervised and structured environment. But what Asians often forget is mental health. Mental illness is something that goes along the lifespan. Oftentimes, people have mild, moderate, and also severe conditions that can be addressed in healthcare. As you may or may not know, about 60% of psychotropic medication or medication for mental health issues are dispensed in primary care. So oftentimes, people with mild and moderate depression, some anxiety, and some acute stress often get treated in primary care. Now, in the country of origins where they come from, that may not necessarily happen because it doesn't exist in the array of healthcare services that they have. And they're also not used to the idea of talking to somebody, or as the talking cure, as a lot of times people call it. They don't see that talking to somebody is actually effective when on the Western cultures have developed and improved on strategies on how to talk problems out that sometimes don't necessarily need medication. So at times, Asians don't see that as part of integrated healthcare, and it's one of the things that the new healthcare integration is going to bring in to healthcare services, in that it is all there for them to provide services or receive services from. Now, one of the challenges, because they also see that mental illness is part of a stigmatized, very much carries superstition and religious connotations, oftentimes people are very shameful of bringing individuals forward to receive services. The lack of understanding of what confidentiality is, or how in this country confidentiality is regulated by laws that does not allow providers to really break it, as compared to the countries of origin. They don't have such oversight from the government. Mental illness, again, continues to be seen as something that it's a bad omen, or something that people did in their previous lives, or it's a genetic component, which many of those things could be true depending as to where you're from and what you believe, but it can be treated. The West has developed a lot of strategies to address mental illness, whether it's through talking on a short-term or long-term phases, or through medication. It could be short-term medication to long-term use medication to ensure that those symptoms are controlled and you can actually improve on your everyday functioning and activity. So educating the Asian community about that mental illness is also something that can be treated in the healthcare arena, is one key thing that we've been trying to do for quite a while, especially for recently arrived immigrant and refugee groups that they really don't understand it, and individuals who don't have as much resources to access healthcare.
So tell me a little bit about the misconceptions about the Asian immigrant experience and the Asian diaspora.
That's a simple and yet very complicated question to answer. Asians, excuse me, oftentimes are seen as only coming from Asia, but a lot of people in the United States don't understand that many Asians have immigrated elsewhere prior to coming to the United States. So for individuals who are seen here, they may look Asian on the outside, but culturally in their identity, they may be coming from, say, Central America, could be Europe, could be Australia, could be South America, or sometimes even Africa. I remember back in college, I met a Chinese guy who was from Jamaica. And I had closed my eyes and I heard a Jamaican person speaking. Then I opened my eye and I was so shocked to see a Chinese person. Likewise, myself, I grew up in Cuba, so oftentimes people see me as Chinese, but when they hear me speak Spanish, they always are confused and they always ask me, where exactly did you learn Spanish? And I always tell them, I learned it in Chinatown. I just didn't tell them that I was in Cuba rather than in the United States. So I think Asians come from many different areas, and they retain a lot of their values from their cultures of origin, but yet they also take in many of the new values that the country of host country offers to them. And especially they're like second generations. Those who are born in that particular country tend to vacillate and go back and forth between different cultural values as to how they want to receive or be perceived. Oftentimes it is a choice that they make. In the past, people have said that was very challenging because it was confusing. But now it actually is seen as a good thing because people then have multiple lenses from which to look and try to solve problems from. So.
Very interesting. So, Dr. Wong, give me an example of how these cultural values can be expressed in a multitude of ways. How can a Latin American culture be combined with an Asian American culture per se?
If I may use myself as an example, having been born in Cuba, I was raised Chinese. So my parents taught me a lot of the Chinese values, the traditions, a lot of the stories, and some of the things that Chinese aspire their kids to do, which is go to school, be a good person and all that. But I think all cultures teach that. On the other side, on the Cuban side, I also learned that what was the value of community, and also what was to give back, and also in regards to growing up and eating foods, oftentimes I like mixing, say, Cuban food with Chinese food. And there's just a lot of groups of, say, Chinese folks who came from Cuba who do that. They may eat like fried rice with pork chops, or some black beans and rice with some sort of dumplings or some sort of Chinese cooked chicken. So that's on the Eastern side. I think also how we engage with individuals. Oftentimes people find me that to be very Chinese, and sometimes they find me to be very Latino. They're more gregarious, more outgoing, seems to have more fun. People attribute that to my Latino side or my Latino cultural identity, versus more the reserved, the much more quiet and taking second seat back. That could also be attributed to my Chinese side. So depending on the context, depending on the environment or what's going on, I might choose to tap into one of those sides to really address the issue, but not necessarily doing it throughout the entire time from that particular perspective. So I have choices. And then coming here to the United States, encompassing what the Asian American identity is and what is expected, now have like three identities or three cultural identity choices to pick from how to address, whether going to school, going to restaurants, engaging in work, or even just choosing what to wear. So.
Okay. So how do these multiple cultures affect mental health issues and maybe perceptions of other people, or their people's perceptions of you?
I think perceptions of mental health issues. I have had the opportunity to really see mental health systems in different countries. So then I bring that knowledge back to address or treat some of the patients that I see or some of the cases I consult with, since I also supervise students. I also bring that perspective and infuse that in the understanding that not just the American model or the model that we are trained in school and in graduate programs is the only model. We really need to adapt it. And I think going back to what makes Aki unique, especially in the training program, is that we've developed this cohort of group of individuals who are very committed to cultural competence, to really adapting a lot of the evidence-based treatments and how to adapt them to multiple cultures, whether through language or through interventions, or adapting in regards to how fast we may apply them or how quickly we take them out, or how we integrate them with other practices, has been something that we've been doing to address the needs of the very diverse multicultural population that comes to Santa Clara County. We try to use some of the principles, but also yet engage in the cultural understanding and respect, so that not only the supervisors are actually seeing patients and also supervising, but the students also get to see how we work and we supervise them in those particular methodologies. We also encourage them to present in professional conferences in regards to what makes cultural competence different in how we apply that to our population. And we also encourage them to stay abreast of the research and the latest literature and scientific findings to ensure that we are not doing something out of the ordinary. So.
Okay. So, as for another topic, how do Asian Americans differ in their metabolism of drugs compared to Caucasians, and how might this affect addictive behaviors, substance abuse, and mental health issues?
Good question. Cultural psychiatry and cultural psychopharmacology has been a field that has been in development for the last, say, 20, 30 years or a little bit more than that. They find that a lot of individuals from different cultures metabolize drugs that have been developed and in particular and tested and researched in European countries, in particular where the pharmaceutical companies are established. So when they actually devise or determine what would be the criteria, how much to give and how long to give, oftentimes that would really not be the best fit for, say, individuals of Asian descent. Some don't have particular genes or alleles or chemicals to break down the medication, whether it's fast enough or slow enough or quick or really absorb it enough. Oftentimes, the more medication you give them, they could overdose. So a whole wing or a whole arm of research has developed in looking at how different cultural groups metabolize drugs, in particular those that are over-the-counter or prescribed medication. So they have developed algorithms to ensure that for a particular group that they know that these drugs may be absorbed much slower, much faster for other groups, and so forth. In regards to the question about addiction, I think we see a lot of individuals who are using substances, whether it's alcohol, marijuana, and some other like ketamines or some sort of painkillers. It seems to be quite common. One of the challenges is, do Asians really come to receive services or seek services in the United States if they find family members who are addicted or are dependent on some of these illicit substances? I think oftentimes the shame and the guilt and the stigma that also comes along with seeking services prevents either a immediate family or a family at large to really seek services. Again, the lack of understanding of how these programs here in the United States work with regards to confidentiality, and that they are proven and tried strategies to help people either come off the medication and maintain them, but we also need the family support. And oftentimes individuals who are using drugs get to be shunned away, so oftentimes they don't get all the support that they would need to really recover. So on the prescription side, it's good to know which cultural groups you're from and ensure that your psychiatrist or whoever is prescribing the medication understands and has done some sort of research to ensure that they prescribe the right medication. On the illicit side, oftentimes it is educating the public that services are available for them to be able to come and seek services out for the family members. Same thing goes with mental health. The more we educate about individuals about mental health services and how it can be prevented and identified, I think the more people hopefully will be able to benefit from services available.
I see. So stigma has a large role in people seeking these resources in terms of substance abuse treatment. So what can we do to move forward in raising awareness and educating people about substance abuse in the Asian American community?
I think a great step is what you're doing right now, inviting professionals from the field to really come and talk on your program about what they see is happening in the community. I think the more that we can educate the public and also to their children to understand what's available, and even older adults, so that oftentimes they are the people in the family circle that actually make decisions. If they can understand what is available, they can therefore make better choices. I think for the family members who is suffering, or even for themselves. I think a lot of times when people immigrate or Asians immigrate to the United States, they lose that whole sense of family or the structure that is really not available here. How they are revered as older individuals, the wise individuals in the family, oftentimes that is not available here. So we find that the more education we provide and the more that they know what's available in the community, they feel empowered, they feel that they're able to contribute more and regain that sense of family structure and family dynamics that was existing back in the country of origin. So I think education is a key component, and the earlier and the more often we do it, I think it could help a lot of Asian Americans to really understand what benefits they have.
So empowerment is a key component in educating the public about mental health.
I agree. I think empowering and actually educating for them to understand that they have choices, what kind of choices, and how do the choices work, and how do the systems work, and someone help them navigate the system is also very important.
So tell us a little bit about how Aki helps people navigate this system.
So one of the new programs that we have in the health side is a health navigator program. We train individuals who just graduated from high school to really understand about healthcare services and what a patient who may be limited in English speaking or doesn't really understand how the healthcare system works, they can connect with these younger individuals who may be very tech savvy, who may be able to understand the language and speak the same language as the individual, and help them go through a primary care or family practice physician and take them to a specialist or other referrals without really having the individual themselves or family members having to figure out where to go, because these navigators have been trained to do so. On the mental health side, we also have peer partners. We have individuals who are recovering from mental illness and are doing really well, and then we encourage them to engage with other consumers or individuals also receiving services and teaching them skills like cooking or actually getting out, finding routes and how to take the buses, going to museums, so that they feel much more integrated into the community. I think the more we normalize it, the easier it is for individuals to receive services. Likewise, on substance abuse treatment, oftentimes it is understood that people who've walked the path can also come back and help individuals who are venturing into the path of recovery. So interestingly enough, with the whole healthcare reform, substance abuse, mental health, and even primary care, you are finding individuals who can help navigate the systems to reduce a lot of the access barriers, if that makes sense. But I think this is a great step, what you're doing here.
Oh, well, thank you. So it sounds like Aki really does a great job of helping individuals seek these resources as well as normalizing the experience. So tell me a little more about how normalizing the experience of recovery and mental health can really transform people in making this journey.
I think you have to also look at different ways of immigration and generational challenges. Oftentimes, individuals who come here, they learn some of the skills, or they face some challenges. They may get addicted or may have their first mental illness experience or a physical health issue. they get services. They know that there's a place in the community that they can come. There's professionals that speak the language. They're very respectful and help them to engage and connect with other services. But as different waves come, or different members of their families also need services, oftentimes their needs may be different. So we also have the challenge to find providers who can adjust and really meet the needs of multiple generations as they come for services. One of the things that we have been able to do is, at least in the mental health side, sometimes we see individuals who are late teens who may have a mental illness and oftentimes become adults, or adults who then, as they get older and continue to receive services, become older adults. So our services change a little bit with a bit of a focus on what they need based on their age and time. So I think we've been able to carry those individuals through so that they can do better. And once they do better, then we ask them to try it out on their own. And if they really face some challenges, they can always come back. We always hear every now and then from individuals who have gone on the outside. And sometimes we receive thank you letters, and sometimes we say, hey, so-and-so helped me quite a bit, whether it's at a domestic violence shelter, our Center for Survivors of Torture, mental health, substance abuse, even problem gambling, even the health center, even the senior centers and youth. It's always great to hear back from them, whether their family members say they're doing great, or we can receive a postcard out of the blues, someone that we haven't seen for quite a few years, but they're doing great. Or if we run into them in the street, they say hi, say, hey, how are you doing?